Life feels like a constant to-do list. You're juggling work, family, maybe trying to squeeze in time for yourself. Lately, you've noticed you're getting up more at night to pee. You laugh it off. Must be the coffee, right? But then it happens again, and again. You feel a little stiffness in your lower back. Your stream's not what it used to be. Maybe things in the bedroom aren't quite as smooth either. You chalk it up to aging, stress, a bad mattress. But what if it's not? Here's the hard truth. Prostate cancer is the second leading cause of cancer death in American men. In 2023 alone, nearly 288,000 men were diagnosed and over 34,000 didn't make it. And early on? It's a master of disguise. Most men don't feel a thing. It doesn't shout. It whispers. That's why today, we're breaking down the subtle early warning signs of prostate cancer, the ones men over 40 can't afford to ignore, because what you learn in the next few minutes could literally save your life, or someone you care about. Prostate cancer starts in the prostate, a small gland below the bladder that most men rarely think about until there's a problem. The tricky part? In its early stages, prostate cancer often doesn't wave a red flag. It creeps in quietly, blending into the background of normal aging. A slower stream, a little more urgency, a few more bathroom trips, stuff most guys just deal with and move on. And let's be honest, we're not always the best at bringing these things up. It's easy to say, "I'm fine," or "it's just part of getting older." But here's where it gets serious. When caught early, prostate cancer has a nearly 100% survival rate. That's not a typo. 100%. The problem is, too many men don't get checked, or they wait until the symptoms get worse, when the cancer is harder to treat. That's why knowing the early signs, even the subtle ones, isn't about being paranoid. It's about being prepared. In the next few minutes, we're going to walk through those early warning signs, the latest screening guidelines, who's most at risk, and how to take action, without panic, but with purpose. So let's get into it. What should you actually be looking out for? Let's start with the most common and most overlooked signs. Urinary changes. If you've noticed that you're peeing more often, especially at night, that's worth paying attention to. We're not talking one extra trip here and there. We mean consistently waking up multiple times. Also, if it suddenly becomes hard to start or stop your flow, or if it feels like your stream is weaker than before, that could be your prostate pressing against your urethra, which can be a sign that something's not right. Other things to watch for: feeling like you still have to pee, even after you just went, or more rarely, but seriously, urine leakage or incontinence. Now let's talk about pain or discomfort, another big category. If you're feeling a dull ache or pressure in your lower back, hips, or pelvis, especially if it's been sticking around, that's worth bringing up. Prostate cancer can press on nerves and nearby tissues. In more advanced cases, you might even feel pain in your bones. And no, it's not always just arthritis. The third category: sexual health changes. This one can be tough to talk about, but it matters. If you're dealing with erectile dysfunction that seems out of the blue, or pain during ejaculation, that's not just in your head. Another thing: decreased volume in your ejaculation or blood in your semen. Not normal. Not something to brush off. And finally, a few general warning signs that can sneak under the radar. Blood in your urine. Unexplained weight loss. Feeling more tired than usual, even after rest or just a general loss of appetite. Now, none of these symptoms automatically mean you have prostate cancer, but they do mean you should have a conversation with your doctor. Because when your body speaks in whispers, it's up to you to listen before it starts shouting. Now, maybe you're thinking, should I get screened? And that's a fair question, because prostate cancer screening isn't one size fits all. Some guys worry about false positives. Others don't want to deal with tests unless something's clearly wrong. And to be honest, it can all feel a little overwhelming. That's where something called shared decision-making comes in. It's not just a buzzword, It's a conversation between you and your doctor about whether screening makes sense for you, not your neighbor, not your uncle, you. The American Urological Association recommends this especially for men between ages 55 and 69. But if you're in your 40s and at higher risk, it's worth starting the convo sooner. This talk usually involves going over your family history, your personal health, your concerns, and what the PSA test might tell you. The goal isn't to scare you into anything, it's to help you make an informed choice. And here's the big takeaway. That one conversation, it could lead to catching something early, way before symptoms even show up. It could mean peace of mind, or the chance to act while treatment is most effective. So don't wait for a crisis to start asking questions. Start with a conversation. Now let's talk about who's more at risk, because prostate cancer doesn't treat everyone the same. First up, age. If you're over 50, your chances of developing prostate cancer go up significantly. In fact, most prostate cancer cases are found in men, older than 65. But that doesn't mean you're in the clear if you're younger. Men in their 40s and early 50s can and do get diagnosed, especially when other risk factors come into play. One of the biggest, your family tree. If your father or brother had prostate cancer, especially if they were diagnosed before age 65, your own risk doubles. And if multiple close relatives were affected, that risk climbs even higher. Prostate cancer can run in families, and knowing your history could be the key to catching it early. Now, here's something that doesn't get talked about enough: race. African American men face a much higher risk of developing prostate cancer. And not just that, they're more likely to develop aggressive forms and be diagnosed at later stages. The reasons aren't entirely clear, but it's likely a mix of genetic factors and disparities in healthcare access. If you're a black man over 40, this is a conversation you should be having with your doctor sooner rather than later. Weight also plays a role. Men who are obese may not be more likely to get prostate cancer, but if they do, it's more likely to be aggressive and harder to treat. The biology of excess fat, inflammation, and hormones like insulin may fuel tumor growth in ways we're still learning about. And then there's the genetic piece. Some inherited mutations, like BRCA1 or BRCA2, which you might know from breast cancer discussions, can also raise the risk of prostate cancer in men. Most men don't know they carry these genes unless they've had genetic testing or a strong family history. All of this to say, if you check any of these boxes, if you're over 50, have a family history, are African American, or carry extra weight, your risk isn't something to guess about. It's something to be informed about, because the more you know, the better equipped you are to take action. Let's hit pause for a second and get something straight. Just because you've noticed one or two of these symptoms, it doesn't automatically mean you have prostate cancer. Frequent urination could be a benign enlarged prostate. Lower back pain might be a pulled muscle from moving furniture last weekend. Fatigue? Who isn't tired these days, right? The truth is, a lot of these signs can be caused by everyday, treatable issues. And that's exactly why they're so easy to brush off until they're not. This isn't about jumping to worst-case scenarios. It's about tuning into your body and giving it the respect it deserves. Because ignoring the signs out of fear or stubbornness, that's how problems get missed. Think of it this way. Getting checked doesn't make you weak. It makes you smart. It makes you the guy who's still around in 10, 20, 30 years because he paid attention. The goal here isn't to scare you. It's to help you stay ahead of something that's far easier to treat when it's caught early. So if something feels off, even if it seems minor, listen to it. You don't need to sound the alarm, but you do need to ask questions. That's how lives get saved. So what should you do with all of this? First, take a deep breath. This isn't about panic. It's about awareness. If something in this video rang a bell, if you've been waking up at night to pee more than usual, feeling off, noticing changes in the bedroom, or even just carrying a family history of prostate cancer, now is the time to check in with your doctor. Don't wait until the symptoms become unbearable. Don't wait for some dramatic sign. Prostate cancer doesn't always come with fireworks. Sometimes it shows up in whispers, and the sooner you listen, the better the outcome. Here's the good news. The first step is simple. Schedule a checkup. Bring it up, even if you're unsure, even if it feels a little awkward. Say something like, "Hey, I've been noticing a few changes and just want to make sure everything's okay. Should I be thinking about a PSA test?" That's it. That's the whole move. And that one question can lead to clarity, peace of mind, or early treatment if something's wrong. And if it turns out to be nothing, fantastic. That's one less thing to worry about. But if it turns out to be something serious, you've just given yourself the best possible chance by catching it early. Remember, you are not powerless here. Knowing your body, asking questions, and taking that first step makes you strong. It makes you proactive, and it just might save your life, or the life of someone you love. Because the truth is, most men won't notice the signs, and even fewer will act on them. Be the exception. Let's bring it all home. Prostate cancer is common, but it's also beatable when caught early. The problem isn't that men don't care, it's that we don't always know what to look for, or we wait too long to say something. And more importantly, you know that the next step isn't scary. It's a conversation, one that could save your life. If you're over 40, especially if you've got a family history or you're in a higher risk group, don't wait. Call your doctor. Start the discussion. Ask if a PSA test makes sense for you. And if you made it to the end of this video, you're already doing something most people don't. You're paying attention. So here's what you can do right now. Share this video with a friend, a brother, a dad, a coworker, someone who might need to hear it. Bookmark it, revisit it, bring it to your next doctor's appointment, and most importantly, don't ignore your body's signals. You deserve to live a long, healthy life, and that starts with being informed, being curious, and speaking up when something feels off. Take care of yourself, stay ahead of it, and we'll see you in the next video.